take the niche courses. At each one of our CME meetings, something is done differently every time. It depends what the local interests are, what they feel is needed, what's required. But we've had more and more requests for specific and more in-depth presentations, workshops on topics such as renal pathology. And for example, in Dubai in February of 2001, we had an outstanding two-day pathology course conducted by Jan Vening of Amsterdam and Helmut Renke of Boston. You and Michelle gave a course on computers, particularly at the working level, where you had a number of sessions asking the question of the attendees, how do you access various websites dealing with nephrology knowledge? Others have come up, and particularly, of course, presentations relating to dialysis, hemodialysis especially, but also PD, and transplantation come up all the time. In Russia this coming summer, in end of May, we will have again a pathology course and an in-depth course in fluid and electrolytes, which will be the first one of its kind we've done there. So the niche courses, of which I've just given you several examples, are being requested more and more. So that's been, I think, a change, and I see more of that happening. One thing that's related to COMGAN, of course, is the development of the model sister centers, and that's still early on, and maybe the next time we talk that'll be much further developed. But the idea was that among the many sisters relationships that we had, some 150, between a center in developing land and one in a developed land, there wasn't enough of a resource underpinning, and that we should in fact find some small amount of money that would aid in travel, aid in meeting the certain goals, whether it was assistance with a computer, whatever. And we now have 6 such centers, such as the one between Ghent and Belgium, Dr. Lemaire, and Dr. Kuznikas, I think it is, in Kaunas, Lithuania. Others are between Havana and Madrid, Toronto and Madras, to mention 2 more. So this is a growing program, and we're hoping that this can in fact be greatly enhanced with regular relationships of higher order. And we discussed this very day here, teleconferencing that might be a particular adjunct. Now, in terms of education, there has been this question as to what is the optimal training in nephrology that should take place. We know what it is here in Canada, what it is in the United States, what most of the European countries carry out. But it varies a lot in many countries. It can be a full program like we're accustomed to, but in some countries it can be as little as 6 to 12 weeks in a subspecialty. There's not the tradition, there's not the time, there isn't the structure, there isn't the availability of resources to have these detailed programs. But nevertheless, we've got requests from many lands saying, what would the ISN recommend? It's not to say that we would certificate. It's not that we would exclude anybody because they didn't have this training. But we would try to make it present in such a manner that we would encourage others to develop more comprehensive and training programs that would be similar in quality, would be as encompassing, but hopefully would take into account their own special nephrology needs. For example, I bet you right here in Alberta you don't talk an awful lot about malarial kidney disease or schistosomiasis in the kidney. Well, these happen to be important topics in countries like Nigeria and Egypt, and so I would feel that any training program would have to take that into account. We have a committee co-chaired by Michael Field of Sydney, Australia, who's an experienced medical educator, and Asker Rastegar, who has been a big help to us in Iran, but also is an associate dean for education at Yale, and is very involved in postgraduate training. And they have put together a committee which is truly global and have gathered information from many lands, and this is going to be the basis of their guidelines that they'll be developing in short order. So the next time we meet, I may be able to give you a fuller account as to what's happened. But this is, again, at the request of the countries where the COMGAN has been active and coming from the participants and leaders that are there.
Right. Now, research and the research initiative, I think this is also exciting.
We've just started in this, at the early part of this year, 2001, a research committee headed by Beppe Ramuzzi of Italy. And he has in his committees very well-known clinical researchers such as Barry Brenner of Boston, Dick de Zoo of the Netherlands, Bill Keane of the United States, Wendy Hoy of Australia, and a number of others who are very much involved in clinical research, especially in terms of the newer information that has perhaps really crystallized in this year relating to specific interventional preventive measures that can be instituted in order to delay progression of chronic renal disease or hopefully even in some instances preventing it by careful control of blood pressure, glomerular pressure in turn, reducing proteinuria through ACE inhibitors or angiotensin receptor blocking agents, and by very careful control of glycemia and diabetes. We're all very concerned about the momentous rise in the incidence of diabetes which is taking place at our time, and the predictions right now that this will move from around 130, 150 million people as is now to about 300 million within the next 10 to 20 years is alarming, especially in developed countries where often, developing countries where often the incidence of nephropathy can be 40% of all the diabetic patients. So this will not eliminate the need for renal replacement therapy, but it may slow down the rate at which it increases, and at least keeps the economic costs in check. So this is going to be a mission of the ISN, which will involve education. It involve doing studies in selected countries to test these observations further, and Dr. Ramuzzi has already done some of this in Bolivia. Dr. Wendy Hoy has done this in the island of Tiwi, which is just off Australia. And so I think you're going to hear this more as a mission where a society actually is going to give a stamp and say, when it comes to kidney disease, we want to give a warning. It's not quite like stop your smoking, right, stop your drinking, but it is in the sense of saying you can do something, you're not trapped. But obviously this raises issues in developing countries in terms of having the people on the ground to do this and meeting costs of many pharmaceuticals which are still patented and which are expensive. So this is the challenge. But I think this is something that the society is latching onto with great enthusiasm.
We'll be interviewing Dr. Brenner, and this program, COMGAN, started as a joint effort of the two of you. Can you tell us a little bit about how he fit into this, and how did the two of you start this?
Well, I think we've been very complimentary at the time, and we were asked as a result of a vision that I think particularly Stuart Cameron and Bob Schreier had to develop a commission that would largely be involved in education of the CME type in developing countries. And I think that has succeeded and has become much more than that. But we were asked